Okay, so welcome. We are going to go through some basic PV IR coders. So we're going to start here by selecting our department. Obviously, we still do cath lab. And let it go through its thing for a second, and then you're going to pick vascular module and proceed. For this, I don't necessarily have a patient, but we enter the patient info just as we would any other way. So I'm just going to skip it for now, and I'm going to put in kind of some fake data. I do have to enter a date of birth. And our physician, we can put, how about this one? Still enter sedation as you would otherwise, and proceed. So we're going to proceed just as we would with the coronary modules. So depending on what you're doing, if you're arterial or venous, we don't do a lot of fistulas, but that is an option here. We're going to just go through arterial and kind of go through the basics of that. So there's going to be this first box up here. You can just kind of disregard that. You're going to go first to your catheter insertion point. So where did you access the artery? Typically, it's going to be common femoral. Sometimes we've got AT or DP or something else that's odd. But typically, most of our access site is right here. So we're going to choose common femoral right. And where are we going to go? So this is going to ask which body system are you looking at? Are you looking at the abdominal area, the head and neck, lower extremity, or upper extremities? Most of ours are going to be lower extremity. Occasionally you get those weird ones where we're going in weird spots. And if you access two spots in the same case, like you do an SMA angiogram as well as an SFA PTA, I can show you how to do that too. So we'll click this to start with. Then it's asking what type of anatomy are we looking at. So all these gray ones are under bypass graft. So if you have a patient with a FemPop bypass or something weird, you can search it through here. Typically, we can just choose lower extremity via contralateral leg, and that's going to be our most common one we're going to pick because that means you're going retrograde against the blood flow on the right side, which is how our sheaths normally fit into the body, and then up and over the aorta into the left leg. The ipsilateral antegrade means your sheath is pointed down towards the toes. Antegrade, retrograde, we do not do that one. You're going to click that. If you used ultrasound, which most of the time we do, click this box here, and you're going to start coding. If you're not sure and you're like, oh, I'm not sure if this was the right choice, a lot of times it'll give you a nice pretty picture. There are some instances that it doesn't, but this at least gives you some indication of, oh, I picked the right one. And you click start coding. All right, so then you're going to scroll down, and these are all of your selections that you can choose from. And so when you're here, you want to click your selections for everything that you did. So if you IVUS something, if you angioed something, or if you ballooned any sort of intervention, you want to click all of those options here. So if we did an abdominal aortogram, you're going to click aorta here. And we can say that we ballooned the SFA. And so you've got vessels all the way down towards the toes. You can search through there. If, like we talked about, there was a situation where we also took an angiogram of the SMA up in a different, body system, you can click up here, catheterize a different body system. And that as well as we have a lot more often that we have bilateral groin access. And this is where you can add a new puncture site. And it'll go through those steps where you find your maybe left common femoral, and it'll ask you for the contralateral leg or wherever else you're looking at. So this will get into our pictures. So this was diagnostic imaging performed. So does that mean, did we take any pictures? The answer is almost always yes. The only time it's not yes is if we put in an IVC filter or took out an IVC filter, and that was all we did. There's something with that code is built into it, and IR coder gets a little finicky with that. So IVC filters, that's the only time you're really clicking no. Otherwise, you're pretty much always diagnosing the problem. If we took a picture down the right leg that we accessed, all the way to the toes or to a little bit further down where it's not just for the sheath, then you click this. It'll give you, was this imaging just for the sheath? You'd click no. If it was just for the sheath, you don't have to click anything. You can leave it as on no diagnostic imaging. For aorta, IR is not super smart that it knows where in the aorta you're looking at, so it gives you all of the options. Most often we're going to be at abdominal aorta, and if we're doing an abdominal aortogram, you're going to choose at or above the renals. That is just the option you need to choose. And then you're also going to click complete abdominal aortogram. These other ones give you weird codes. This is the one we need. And then if we also took an image down the left SFA, we're going to click that as well. These two boxes, we really don't mess with. You can just ignore them. Down here, this is where we IVUS. So if you want to choose IVUS, you can choose yes and click where you IVUS. We're going to say that we didn't IVUS. We don't IVUS a ton in the periphery, but we do have that as an option. All right, so then this is just a page that's confirming your codes. You can finish and continue. Then it'll get you to therapeutic interventions. So if you did any therapeutic interventions, you need to say yes, or it won't give you any of these options. You click yes, and so in here you've got embolization. So if we did any coils, that's embolization. Endovascular repair. Usually if we're doing endovascular repairs, you're phoning a friend to me to help with this one. Foreign body retrieval, that's your snaring. Infusion therapy is like if we do ECOS or if we leave in a fountain catheter. We don't necessarily ever click this pressure measurements. Revascularization is going to be what you want for any angioplasty, atherectomy, stenting, and lithotripsy. And it asks you, did you do it in the lower extremity or not the lower extremity? We'll say it's going to be in the lower extremity. Temporary balloon occlusion. We really only do that in a lot of hybrid cases. So typically we don't have to choose this because the hybrid cases are billed through CBOR. And then thrombectomy, and we know what that is. So then we get to this page, and so this is asking what type of revascularization did we do to our vessels. And so it's going to ask for all the vessels. It asks if there's stenosis or occlusion. And if you are not sure, you need to ask your physician or look in their dictation because most of them dictate right away. We are going to say most of the time it is stenosis. So if you're not sure and they're running out of here, I would choose stenosis over occlusion. It's usually pretty evident if it is occlusive. And then you can choose angioplasty. If we did a DCB, you click that. Our inventory is not tied to IR coder, so it's not a big deal if you don't click that one. We've got atherectomy, stenting, and then lithotripsy. That's all you do for that. And continue. And it'll show you your codes. Then you put in your closure devices if you use them. Let's say we used one. And that's it. And then you finish and send, and that's that. Hope you enjoyed this.